Respected audience, Assalamu alaikum. I am Professor Shamsuzzaman, Professor of Pathology. I welcome all in today's second lecture on systemic pathology. Today, day 2 of esophageal diseases. Today's topic is Carcinoma of Esophagus. Day 2 of esophageal disease. Today's topic, Carcinoma of Esophagus. Today's topic is Carcinoma of Esophagus. Dear audience, before going to discuss about the Carcinoma of Esophagus, we have to know what are the different tumors that may occur in the esophagus. Now come to tumors of esophagus. The tumors may be benign tumor or benign neoplasm and malignant neoplasm or malignant tumor. First come to what are the different types of benign tumor, that is what are the different types of benign neoplasm that may occur in esophagus. First come to benign tumors or benign neoplasms. The benign tumors may be a stromal cell tumor. It is also called a spindle cell tumor. And stromal cell tumor or spindle cell tumor may be leiomyoma. Dear audience, you know leiomyoma is the benign neoplasm of smooth muscle, and it may be fibroma. You know benign tumor of fibroblast is called fibroma. There may be lipoma, benign tumors from the adipose tissue. There may be hemangioma, benign tumor of blood vessel, lymphangioma, lymphangioma is the benign tumor of lymphatics. There may be neurofibroma. So these are the different benign tumors that may occur in the esophagus. Dear audience, suppose this is the esophagus and this is the stomach. Up to this esophagus, this is esophagus, there may be benign neoplasm. Now come to malignant neoplasm of esophagus. And malignant tumors of esophagus. The malignant tumors may be squamous cell carcinoma, and this is the commonest malignant tumor of esophagus. There may be adenocarcinoma, there may be undifferentiated carcinoma, Besides this, Besides this, there may be leiomyosarcoma, there may be fibrosarcoma. So these are the different malignant tumors. Of esophagus. Today's topic is carcinoma of esophagus. Now come to carcinoma of esophagus. Dear audience, carcinoma may be squamous cell carcinoma, adenocarcinoma, undifferentiated carcinoma. First come to squamous cell carcinoma of esophagus. Dear audience, we want to recapitulate what is the lining epithelium of esophagus. Esophagus is lined by non-keratinized, stratified squamous epithelium. Squamous cell carcinoma of esophagus. What are the predisposing factors of squamous cell carcinoma of esophagus? Predisposing factors. Predisposing factors of esophageal squamous cell carcinoma. The factors may be dietary factor, pre-existing disease of esophagus, dietary factor, pre-existing disease of esophagus, lifestyle, genetic predispositions. So these are the predisposing factors of esophageal squamous cell carcinoma: dietary factor, pre-existing disease of esophagus, lifestyle, genetic predispositions. First come to dietary factor associated with esophageal carcinoma. Dietary factors: food contaminated with fungus, food contaminated with fungus, diet with high content of nitrites and nitrosamine, high content of nitrites and nitrosamine, high content of nitrites and nitrosamine, deficiency of vitamin A, vitamin C, thiamine, riboflavin. So diet deficient with vitamin A, vitamin C, thiamine, riboflavin. Deficiency of trace elements like zinc, molybdenum. So deficiency of trace elements like zinc, molybdenum. These are the dietary factors associated with squamous cell carcinoma of esophagus. Now come to pre-existing disease of esophagus. Pre-existing disease of esophagus. Dear audience, there are some diseases of esophagus. That disease may lead to esophageal squamous cell carcinoma, like achalasia of esophagus. Achalasia of esophagus means failure of relaxation of esophagus due to neural defect in lower end of esophagus. Dear audience, this is the esophagus. If there is neural defect in the lower end of esophagus, if there is neural defect here, there will be failure of relaxation of the esophagus, and this is known as achalasia. Achalasia may lead to esophageal squamous cell carcinoma. Esophageal diverticulum. Esophageal diverticulum. Dear audience, if there is diverticula here in esophagus, like this, and this diverticula may be associated with squamous cell carcinoma of esophagus. So these are the pre-existing diseases of esophagus that may lead to esophageal carcinoma. Now come to lifestyle. Lifestyle, tobacco abuse. Tobacco abuse is associated with carcinoma of the oral cavity, carcinoma of the esophagus, and carcinoma of the stomach also. Alcoholism. Dear audience, you know alcoholism is associated with esophagitis, and it may also lead to esophageal squamous cell carcinoma. Dear audience, now come to morphology of esophageal squamous cell carcinoma. Morphology of esophageal squamous cell carcinoma. Suppose this is esophagus, this is the wall of esophagus, and this is the lining epithelium of the esophagus. Like this. If there is esophageal squamous cell carcinoma, what may be the morphology? First come to gross examination. Gross examination of esophageal squamous cell carcinoma reveals polypoid mass. It reveals polypoid mass. Dear audience, we know finger-like or tongue-like projection from the mucosa is known as polyp. So there will be polypoid mass like this, polypoid mass. And this polypoid mass may be ulcerated. This polypoid mass may be fungating. Or this polypoid mass may be infiltrative. So on gross examination, the mass is polypoid, the surface may be ulcerative, surface may be fungating, or the mass may infiltrate in the tissue. This is the gross examination of the squamous cell carcinoma of the esophagus. Now come to histopathology of squamous cell carcinoma of the esophagus. Histopathology reveals anaplastic cells arranged as sheets or groups invading the stroma. Histopathology reveals anaplastic cells are arranged as sheets or groups invading stroma. This is the histopathology of squamous cell carcinoma of the esophagus. Anaplastic cells are arranged as sheets or groups invading the stroma. These are the anaplastic cells of squamous cell carcinoma of esophagus. The cells are arranged as sheets. Large cell with large hyperchromatic nucleus. Cells show squamous differentiation. Altered nuclear cytoplasmic ratio of the cells. Prominent nucleoli. And the cells are arranged as sheets. If this is the stroma, the anaplastic cells may invade the stroma like this. This is the invasion of the anaplastic cells in the stroma. So this is the sheets of anaplastic cells, and this is invasion in stroma. This is the histopathology of squamous cell carcinoma of esophagus. Dear audience, now come to adenocarcinoma of esophagus. Adenocarcinoma of esophagus. Dear audience, the most common carcinoma of esophagus is squamous cell carcinoma. It is about 80 to 85%. And adenocarcinoma is less common. It is about 5 to 15%. Now come to predisposing factor of adenocarcinoma. Predisposing factor of adenocarcinoma of esophagus. The predisposing factor is Barrett esophagus or Barrett mucosa. Barrett's mucosa or Barrett esophagus is the predisposing factor of adenocarcinoma of the esophagus. Dear audience, you know, if anybody suffers from frequent gastric reflux in the esophagus, there will be columnar metaplasia in the lower end of the esophagus. That is, the squamous cell of the lower end of the esophagus is replaced by gastric columnar or intestinal-like columnar cell. When there is columnar metaplasia due to frequent or repeated gastric reflux, this is known as Barrett mucosa or Barrett esophagus. according to name of scientist Barrett. And Barrett mucosa is the predisposing factor of adenocarcinoma of esophagus. Now come to morphology of adenocarcinoma of esophagus. Gross examination reveals nodular mass in the lower end of esophagus. Nodular mass at lower end of esophagus. Suppose this is lower end of esophagus, there will be nodular mass in the lower end of esophagus. This is gross examination of adenocarcinoma of esophagus. Now come to histopathology of adenocarcinoma of esophagus. Histopathology reveals glandular differentiation of anaplastic cells, and anaplastic cells are arranged as glands and it may invade the stroma. Glandular differentiation of anaplastic cells and cells are arranged as glands. Glandular differentiation of anaplastic cells and cells are arranged as glands. Anaplastic cell may invade the stroma. Dear audience, these are the anaplastic cells showing glandular differentiation and arranged as glands. And these cells may invade the stroma. This is the histopathological findings of adenocarcinoma of esophagus. Dear audience, today I have told you about the different types of benign and malignant neoplasms of esophagus. Among the malignant neoplasms, most common malignant neoplasm is squamous cell carcinoma, and there are some predisposing factors of squamous cell carcinoma of esophagus: dietary factor, food contaminated with fungus, high content of nitrates and nitrosamines, these are the carcinogen, deficiency of vitamin A, C, thiamine, riboflavin, deficiency of zinc, molybdenum, pre-existing disease of esophagus like achalasia, like diverticular. Achalasia means relaxation of the esophagus or esophageal wall due to neural defect at lower end. Lifestyle is associated with squamous cell carcinoma of esophagus like tobacco abuse, alcoholism, and also genetic predispositions. The morphology of squamous cell carcinoma: polypoid mass grossly, it may be ulcerative or fungating, or it may be infiltrative. And histopathology reveals sheets or groups of anaplastic cells that show squamous differentiation and it invades the stroma. Adenocarcinoma, the predisposing factor of adenocarcinoma is Barrett esophagus. This occurs at the lower end of the esophagus, and grossly it is nodular mass histopathology reveals glandular differentiation of the anaplastic cells, and the cells are arranged as glands. Dear audience, today up to this, thanks all.